What if I told you that the very medications you take every day thinking you're staying healthy might actually be slowly stealing your vitality? This is not some fringe theory. Behind the scenes, scientists and geriatric specialists have been sounding the alarm about certain drugs that cause devastating effects in adults over 65. Yet, these medications remain some of the most prescribed drugs in America. The problem is that most doctors simply do not have time to explain every risk. So, you don't get the explanation to why your parents suddenly became confused. You don't know why your spouse keeps falling. And they certainly do not have time to walk you through what a landmark study from Johns Hopkins revealed. Researchers found that adverse drug reactions send over 2 million older adults to emergency rooms every single year. 2 million. And the truly shocking part, most of these emergencies were completely preventable. The drugs we are about to discuss have been hiding in plain sight. They sit innocently in medicine cabinets across the country. Your loved ones take them every morning without fully understanding the risks. And wait until you hear about number 2 on our list. The evidence against this common medication is so compelling that researchers called it a public health crisis that demands immediate attention. So here is what the latest science wants you to know. Before we dive in, I have 2 questions for you. First, how many medications does your loved one currently take each day? Second, has anyone explained all the potential side effects to them? Drop your answers in the comments below. We are reading and replying to each and every comment. Now, without any further ado, let's get started. Number 5, diphenhydramine, Benadryl, and sleep aids. Starting at number 5 on our list is a medication that millions of seniors reach for every single night. Diphenhydramine is the active ingredient in Benadryl and countless over-the-counter sleep aids like Tylenol PM, Skeel and Advil PM. You can buy it anywhere without a prescription. This easy availability makes people assume it must be safe. That assumption could be harming your loved one's brain. Diphenhydramine belongs to a class of drugs called anticholinergics. These medications work by blocking a chemical messenger in the brain called acetylcholine. This same chemical messenger plays a crucial role in memory, learning and attention. When you block it, problems can develop. A groundbreaking study published in JAMA Internal Medicine in 2015 followed nearly 3,500 adults aged 65 and older for over 7 years. The researchers discovered something alarming. People who used anticholinergic drugs like diphenhydramine for 3 years or longer had a 54% increased risk of developing dementia. Let that sink in. Taking Benadryl regularly for 3 years increased dementia risk by more than half. The problem gets worse when you understand how aging changes the body. As we get older, our livers and kidneys become less efficient at clearing medications. This means diphenhydramine stays in an older person's system much longer than in a younger person. A dose that would wear off in 4 hours for a 30-year-old might linger for 12 hours or more in someone over 65. During all that time, the drug continues blocking acetylcholine in the brain. The effects are cumulative. Each dose adds to the burden, and the brain of an older adult is already more vulnerable because acetylcholine levels naturally decline with age. Many seniors do not even realize they are taking this drug. It hides under dozens of brand names. It lurks in combination products marketed for colds, allergies, and sleep. Your loved one might be taking it multiple times daily without knowing they are exposing themselves to the same anticholinergic chemical over and over again. The solution here is surprisingly simple. For allergies, newer antihistamines that do not cross into the brain work much better for older adults. Cetirizine, which is Xeric, and Laorodine, which is Claritin, provide effective allergy relief without the cognitive risks for sleep problems. The answer requires a different approach entirely. Cognitive behavioral therapy for insomnia has been proven more effective than any sleep medication in the long term. A 2016 study from the American College of Physicians found that cognitive behavioral therapy produced better sleep outcomes than medications and had 0 side effects. Low-dose melatonin, typically around 0.5 mg to 1 mg taken 2 hours before bed, can also help regulate sleep cycles naturally. The key is addressing why sleep is disrupted rather than sedating the brain into submission. Talk to a doctor about tapering off diphenhydramine slowly and implementing these safer alternatives instead. Before we continue, if you found this helpful, hit that like button so we can get this information in front of more people who need it. YouTube shows this video to more seniors every time you hit like. Don't forget to subscribe. We've got more powerful senior health tips videos coming every day, and you don't want to miss the next one. Number 4. Proton pump inhibitors. Coming in at number 4 are medications that seem completely harmless. Proton pump inhibitors, which are commonly known as PPIs, include brand names like Pyloc, Nexium, and Provizit. Doctors prescribe them for heartburn, acid reflux, and stomach ulcers. They work incredibly well at their intended job. They reduce stomach acid dramatically, but that very effectiveness creates serious problems when these drugs are used long-term by older adults. Stomach acid exists for important reasons. It helps break down food so nutrients can be absorbed. It kills harmful bacteria before they can infect you. It activates enzymes needed for proper digestion. When you suppress stomach acid for months or years, the consequences ripple throughout the entire body. A study published in JAMA Neurology in 2016 examined over 73,000 adults aged 75 and older. Researchers found that regular PP users had a 44% higher risk of dementia compared to those who did not use these drugs. Another study in the Journal of the American Geriatric Society found that PPIs increased the risk of hip fractures by 35% in older adults. The fracture connection makes perfect sense when you understand the science. Calcium requires stomach acid for proper absorption. When you block acid production, calcium cannot be absorbed efficiently. Over time, bones weaken. For an older adult who already faces increased fracture risk, this medication-induced calcium malabsorption can be devastating. A single hit fracture in someone over 65 leads to death within 1 year in 20% to 30% of cases. These are not abstract statistics. These are real people whose bones broke because their heartburn medication was interfering with calcium absorption. PPIs also increase the risk of serious infections. Remember how stomach acid kills bacteria. Without that protection, dangerous bacteria like Clostridium difficile can survive passage through the stomach and colonize the intestines. C. diff infections cause severe diarrhea, dehydration, and can be fatal in older adults. A meta-analysis combining data from multiple studies found that PP used increased CIFF infection risk by 65%. The path forward involves understanding why acid reflux happens in the first place. For most people, lifestyle modifications can dramatically reduce symptoms. Eating smaller meals reduces pressure on the stomach valve. Avoiding food within 3 hours of bedtime prevents acid from pooling while lying down. Elevating the head of the bed by 6 in uses gravity to keep acid where it belongs. Losing excess weight removes pressure from the abdomen. Identifying trigger foods, which commonly include coffee, chocolate, alcohol, and spicy dishes, allows targeted avoidance rather than wholesale acid suppression. If medication is truly necessary, using PPIs at the lowest effective dose for the shortest possible time minimizes risk. Many people who have taken PPIs for years can gradually taper off with their doctor's guidance and manage symptoms through these natural approaches instead. Number 3. Benzodiazepines. At number 3, we encounter medications that doctors have been prescribing for anxiety and sleep for over 50 years. Benzodiazepines include household names like Xanax, Valium, Ativan, and Klonopin. These drugs work by enhancing the effect of a calming neurotransmitter called GABA in the brain. They produce rapid relaxation and sedation, and they are creating significant harm among older adults that often goes unrecognized. The American Geriatric Society explicitly lists benzodiazepines on its Beers criteria, which is a list of medications that should generally be avoided in people over 65. This is not a controversial position. The evidence against these drugs in older adults is substantial. A landmark study published in the British Medical Journal followed nearly 9,000 adults over 65 for 15 years. Those who used benzodiazepines had a 51% higher risk of developing dementia. The researchers controlled for factors like depression and anxiety that might otherwise explain the connection. The drug itself appeared to contribute to the cognitive decline. Falls represent another devastating consequence of benzodiazepine use in older adults. These medications cause sedation, impaired coordination, and slowed reaction times. A systematic review published in Age and Aging found that benzodiazepine users were 41% more likely to experience falls. For an older adult, a fall can change everything. It can mean a broken hip, loss of independence, nursing home placement, or death. Every year, 3 million older adults are treated in emergency rooms for fall injuries. Benzodiazepines contribute to many thousands of these preventable accidents. The dependence potential of these drugs creates additional problems. Benzodiazepines were designed for short-term use, typically 2 to 4 weeks. Yet, many older adults have been taking them for years or even decades. Physical dependence develops quickly. Stopping abruptly can trigger dangerous withdrawal symptoms, including seizures. The brain becomes accustomed to the artificial GABA enhancement and cannot calm itself naturally without the drug. This creates a situation where the medication originally prescribed to reduce anxiety now causes severe anxiety whenever someone tries to stop taking it. Breaking free from benzodiazepines requires a careful gradual approach. Stopping suddenly is dangerous and unnecessary. Working with a knowledgeable doctor, the dose can be reduced by about 10% every 1 to 2 weeks. This slow taper allows the brain to readjust gradually. During the tapering process, implementing other anxiety management strategies helps fill the gap. Cognitive behavioral therapy has strong evidence for treating anxiety without medications. Regular exercise produces natural calming effects by boosting endorphins and reducing stress hormones. Mindfulness meditation practices have been shown to physically change brain structures involved in anxiety regulation. Some older adults benefit from switching to a longer-acting benzodiazepine during the taper, which produces more stable blood levels and easier reduction. The goal is complete discontinuation, but reaching that goal safely takes time and proper medical support. Number 2. Opioid pain medications. Number 2 on our list represents one of the most significant medication challenges in modern healthcare. Opioid pain medications include drugs like oxycodone, which is sold as OxyContin, and percoate hydrocodone, which is sold as Vicodin, and norcomorphine and fentanyl. For decades, these drugs were prescribed more liberally than the evidence supported. Medical organizations have since updated their guidelines significantly, but millions of older adults remain on these medications, often without understanding the full scope of risks they face. The statistics are concerning. Adults over 65 receive more opioid prescriptions than any other age group. A CDC study found that opioid-related hospitalizations among older adults increased by 34% in just 5 years. Overdose deaths in this age group have been climbing steadily, but death is only the most extreme outcome. The daily toll of opioid use in older adults includes falls, confusion, constipation so severe it requires emergency intervention, and a phenomenon called opioid-induced hypolesia, which means the pain medication actually makes pain worse over time. The fall risk associated with opioids in older adults cannot be overstated. A study in JAMA Internal Medicine found that opioid use increased fall risk by 400% in the first 2 weeks of starting therapy. 400%. These drugs cause dizziness, sedation, and impaired balance in everyone. In an older adult whose coordination is already affected by aging, the effects are magnified dramatically. The cognitive effects of opioids mirror those of the other drugs on this list. Research published in the Journal of the American Geriatric Society found that older adults taking opioids performed significantly worse on tests of memory and attention compared to those not taking these drugs. Long-term opioid use may contribute to lasting cognitive decline. The brain changes that occur during chronic opioid use do not simply reverse when the drugs are stopped. Finding better approaches to chronic pain is essential. First, pain in older adults deserves thorough investigation rather than reflexive prescription. Sometimes pain signals an underlying condition that can be specifically treated. Second, non-drug approaches to pain management often work better than opioids for chronic pain. Physical therapy strengthens supporting muscles and improves function. Cognitive behavioral therapy for pain helps rewire how the brain processes pain signals. Studies show that CBT can reduce chronic pain intensity by 30% or more without any medications. Acupuncture has moderate evidence supporting its use for several chronic pain conditions. Topical treatments like lidocaine patches can address localized pain without systemic side effects. Low-dose antidepressants, particularly duloxetine and certain tricyclic, can modulate pain pathways when other approaches are insufficient. For older adults currently taking opioids, working with a pain specialist to develop a comprehensive tapering plan while implementing these alternatives offers the best path forward. Number 1. Anticholinergic medications, especially bladder drugs like oxybutynin. The medication class that earns the number 1 spot on our list might surprise you. Strong anticholinergic drugs, particularly bladder medications like oxybutynin, which is sold as ditropantolterdine, which is sold as Drol, and solenosin, which is sold as Visicare, pose extraordinary risks to older adults that most people never hear about. These drugs are routinely prescribed for overactive bladder, which is a condition that affects millions of seniors, and they may be systematically harming brain function in ways that go unrecognized. We discussed anticholinergics earlier with diphenhydramine. These bladder medications represent the most potent anticholinergics commonly prescribed to older adults. They flood the body with acetylcholine-blocking effects. A 2019 study published in JAMA Internal Medicine examined medical records from over 280,000 adults aged 55 and older. The researchers found that strong anticholinergic drugs increased dementia risk by 50%. For each additional year of use, the risk climbed higher. Among the highest risk medications identified were these bladder drugs. The difficult reality of this situation becomes clear when you understand the full picture. Overactive bladder causes urgency, frequency, and sometimes incontinence. It profoundly affects quality of life. It causes embarrassment and social isolation. Seniors desperate for relief take medications their doctors prescribe. They trust that these drugs are appropriate. They have no idea that they may be trading bladder control for brain function. This is not a trade most people would accept if they were fully informed about the risks. The brain effects often go unnoticed at first. Confusion develops gradually. Memory lapses accumulate. Family members might attribute changes to normal aging. The medication connection remains hidden. A study in the Journal of Clinical Pharmacology found that older adults taking oxybutynin showed measurable cognitive decline within just 2 weeks of starting the medication. 2 weeks. Imagine the cumulative impact from years of continuous use. Better options exist for managing overactive bladder. Behavioral approaches should always come first. Bladder training involves gradually increasing the time between bathroom visits, which trains the bladder to hold more urine comfortably. Pelvic floor exercises, which are often called Kegels, strengthen the muscles that control urination. These exercises have been shown to reduce incontinence episodes by 60% or more when performed consistently. Limiting fluid intake in the evening reduces nighttime urgency. Avoiding bladder irritants like caffeine, alcohol, and artificial sweeteners can make a significant difference. Timing medication doses, particularly diuretics, for earlier in the day prevents nighttime problems. If medication becomes necessary despite behavioral approaches, newer options carry lower risk. Mirabrun, which is sold as Ribetric, works through entirely different mechanism that does not block acetylcholine. Studies show it is effective for overactive bladder without the cognitive side effects. Vibegron, which is sold as GEMS, represents another non-anticholinergic option. For older adults currently taking drugs like oxybutynin, discussing these alternatives with a healthcare provider could protect their most precious asset, which is their cognitive health. At the end, there are drugs that work reasonably well in younger adults, but can become problematic in older bodies. Metabolism slows. The blood-brain barrier becomes more permeable. Organs that clear medications become less efficient. These physiological changes transform acceptable risks into concerning ones. Remember, every medication on this list has legitimate uses. None should be dismissed entirely, but informed decision-making requires understanding the full picture. Older adults and their families deserve to know that alternatives often exist. They deserve to participate in decisions about their care with complete information about risks and benefits. The path forward involves asking questions, exploring alternatives, and advocating thoughtfully for the health of those we love. Share this information with anyone who has a loved one over 65. The conversation might feel uncomfortable. The changes might take effort, but protecting the minds and bodies of our elders is worth every bit of that effort. Also, a quick reminder that this video is for educational purposes only. Always talk to your health care provider before making any changes to your medications. Stay safe and thanks for watching.